on and turn it off. You would turn it on with just a toggle here at the end. You would test the suction pressure by occluding the suction end, the tubing, and then adjusting it with a knob. This one, the knob happens to be here at the end. So I'm at about 100 to 120 right now, negative 100 to negative 120. So that would work for me. I would leave that suction tubing attached and leave it on for suctioning. Just for the purposes of noise, we're not going to do that. So this would be on, this would be ready in a place where I could easily reach it. I would have come in and told the patient, hey, Mr. Larry, I'm Jen from respiratory. I am going to have to suction your nose to get some of those secretions in your lungs, or phlegm. Don't say sputum to a patient. They don't know what you're talking about. I'm gonna get my stuff set up and I'll let you know what I'm doing as I do it. I would also have my ambu bag attached to a flow meter, running at what liter flow? What does an ambu bag get set at? At least 15 liters per minute, sometimes flush. I would have this ready to go, plugged in to pre-oxygenate, easy to reach so I don't break my sterile field. And then I would make sure I have my materials. So I have my suction kit. This is the type that you guys have. I have my lubricant. Again, you would use what kind on a patient? Water-based lubricant. And we can pretend we have sterile water. You don't actually have to pour the water out for the purposes of practice. So I have my sterile water available. When I open my kit, I usually like to lay down a Chucks because I want to keep things clean. I have already sanitized my hands and I have gloves on. I am going to open my suction kit. Everything in this kit is sterile. So if my clothes touch it, if my lab coat touches it, if my stethoscope or my badge touch it, it's no longer sterile inside, okay? So you want to be very careful when you open it. So I'm going to open my kit, and I probably want my gloves first, so you might have to adjust the way that you open it. So I haven't touched anything inside yet. I'm going to carefully get my gloves. Oh, it's everything in one here. So they make it tricky.
I just had them shake it out on the...
Yeah, that's fine.
Yep, there you go.
I didn't touch the inside yet, and I didn't touch the box for water, so I just kind of dropped it back onto the sterile field. Now I'm going to open my gloves, and you just kind of want to get that paper touching at the corners so that it stays open. Some gloves, when you open them, it'll tell you right, left. These are what they are. For the first glove that you put on, you are going to touch the inside of the glove. So the cuff is folded over. You can see how the cuff is folded over here. I'm going to pick up the glove from the inside, and of course they're going to stick together because that is just the best way to learn. Okay, so you can kind of look at it. This is my thumb. So I'm still just touching the inside because my clean hand is going to be going on the inside. And get it on, oh, I did it wrong. Get it on the best you can. Once you have your other glove on, you can do some adjustments when both hands are sterile. If you need a bigger size sterile glove, we have some available if the ones in the kit don't work. So you can see my pinky is kind of wonky, but I'll fix it when I get my other glove on. Now this hand is sterile. When I touch the second glove, I want to scoop my hand in the cuff. Where's the thumb? I want to scoop my hand in the cuff and pick it up that way. Boy, these are tricky. So now my sterile is touching sterile. I can pull my glove on. Do the best you can. You can touch the outside parts of the gloves now because you are sterile. So I get that one on. This one I'm just gonna kind of touch the outside. Work my pinky does not want to go in
It
there.
does not.
Work the, it really doesn't, guys. Work my pinky up in there. I'm only touching the outsides now. I'm sterile. If I touch anything but what's in this side of this package, I will break sterile field. Another thing that I should have done before I put my gloves on would be to put my water-based lubricant. If you squirt it out of the package so that it drops on the sterile field, don't touch the packaging to the paper, it's still sterile, okay? So I would have done that. I'm gonna get my water set up. Now, typically your suction hand is gonna be your dominant hand. There are gonna be times where the way the patient is, the way you can set up, it won't be, but make it easy on yourself. Make your sterile hand your dominant hand. So this is my dominant hand. I'm going to open up my water with my clean hand, put some water in my box. This is my clean hand, this is my sterile hand. I'm going to either get my catheter out or drop it out. It needs to stay sterile.
Did you do that before you do the water? So you have two?
Perhaps, but I didn't do it that way, did I?
Just curious.
Perhaps. I like to hold my catheter bunched up in my hand like this. Professor Klima is a wrap the catheter kind of gal. So you can, she is. And it's, you know, it depends what you have. You will use your clean hand on this green port. So if you want to wrap it, you would do a wrappy wrap. And still your sterile hand is only touching the catheter, okay? I'm not a wrappy girl, I'm a fold girl. So I'm gonna have mine folded, and then that will be open and available to connect to suction. So at this point, I'm gonna tell my patient, okay, Mr. Larry, I am going to give you some oxygen with your clean hand before we suction you so that you don't drop your oxygen number. I'm gonna pre-oxygenate him for how long? 1 to 2 minutes. I don't have to bag him. If he's spontaneously breathing, I just have to give him 100%. So it's been 1 to 2 minutes. Okay, Mr. Larry, I'm gonna go ahead and suction out your nose and we'll get some of that phlegm out. So I connect here. You're going to go in, feed it down, feed it down, feed it down, feed it down, feed it down. When I reach resistance, and you'll never guess, oh, that one's about 26, 25. I've met resistance, I probably hit his carina. So I'm gonna bring it out a little centimeter or two, and then watch my thumb on my non-dominant hand. I am doing intermittent suction. Notice how I'm pulling the catheter through my fingers, and then I end up with the end of the catheter in my hand. I'm going to hold on to that again, let this hang so nothing touches it. I'm going to give my man some oxygen. And what's a quick way I can check to see if he needs to be suctioned again?
Feel his
Yes. I'm gonna check it out. Let's see if he needs to be, feels better. Hey, Mr. Larry, how do you feel? He feels better. I can be done. The video showed you to take off your glove and all that. You're gonna use this to practice. So I would not remove your glove and put your catheter inside of it. Just disconnect, set yourself back up for success. The other thing you can do, because you did pour that water, if you don't need to clear your catheter, I usually will just suck it up to clear the suction tubing line. Plus, that way you're not having to deal with a little box of water left behind. And then what are we gonna document?
How many times you went down?
breath sounds, I agree.
Other
Patient's color, oh, the color, smell, consistency, amount of sputum,
Say it louder,
yes.
Jane.
Time and date.
Say it louder.
Time and date,
She didn't
yes.
I
hear you.
did say time and date, and then
Okay.
how many times you went down.
How many times you went down, that you pre and post oxygenated,
Just been set patient response.
patient's subjective response, if they're able to give you a subjective response.
Would
So when you,
document which nair you went down?
you would say what side you went down. It may even ask you if the nair was patent. If you tried to go down the left and it wasn't patent, you had to go down the right, you probably would document that. When you are done, put your stuff back in, and then like